Hello, I'm Amy Lewis, and this is my presentation on the interrelation of obesity and cancer. I'd like to start off my presentation by defining the terms obesity and cancer. According to the Merriam-Webster Medical Dictionary, obesity is defined as a condition that is characterized by excessive accumulation and storage of fat in the body, and that in an adult is typically indicated by a BMI of 30 or greater. Obesity is related to a host of medical problems and complications. However, today I'd like to look at its relationship to cancer. According to that same medical dictionary, cancer is defined as a malignant tumor of potentially unlimited growth that expands locally by invasion and systemically by metastasis. The most common types of cancer globally, according to data from the Global Cancer Observatory, are lung cancer, breast cancer, and colorectal cancer. Because these are the most common types of cancer, they are the types that I will be discussing today and their relationship to obesity. So I'd like to begin by talking about the relationship between obesity and lung cancer. According to this study, overall and central obesity and risk of lung cancer, a pooled analysis, BMI and lung cancer risk are actually inversely related for reasons that we don't know yet. However, if you look at central obesity independently of BMI, it actually has a positive association with risk for developing lung cancer. So, measures of central obesity, such as waist-hip ratio or waist circumference, can be used to identify individuals who may be more at risk for developing lung cancer. Next, I'd like to talk about the relationship between obesity and breast cancer. So, according to the study Obesity and Adverse Breast Cancer Risk and Outcome, Mechanistic Insights and Strategies for Intervention, there's actually a difference in how obesity affects the breast cancer risk of premenopausal and postmenopausal women. In premenopausal women, obesity was actually associated with a lower risk of estrogen receptor positive breast cancer and a higher risk of triple negative breast cancer. For brief background information, estrogen receptor positive breast cancer involves cells that have estrogen receptors on them and therefore will respond positively to and possibly proliferate in the presence of estrogen. While triple negative breast cancer has cells with no estrogen receptors, no progesterone receptors, and do not make too much of the protein HER2. In postmenopausal women, however, obesity was associated with a higher risk of estrogen receptor positive breast cancer, and it had very little effect on estrogen receptor negative breast cancer risk. In both groups of women, obesity was associated with a higher risk of death from breast cancer. Next, I'd like to talk about the relationship between obesity and colorectal cancer. I actually have two studies here. In the first, Obesity and Risk of Colorectal Cancer, a systematic review of prospective studies, the researchers found that both general and central obesity were associated with an increased risk of colorectal cancer. In the second study, NLRP3 inflammasome, a possible link between obesity-associated low-grade chronic inflammation and colorectal cancer development, they examined the activity of inflammasomes because adipose tissues actually have increased inflammasome activity, and therefore obesity is able to lead to the state of chronic inflammation due to all of the adipose tissue and the inflammasome activity in such. The data showed that inflammasomes may actually play a major role in the development of obesity-related colorectal cancer. So some practical implications of these findings would be for physicians to see obesity as an indicator of increased risks for patients to either develop or die from certain cancers, and for patients who are obese to be made aware of these increased risks so that they can make the very best decisions for their own health in light of them. How can the situation be improved? Of course, that's going to be by treating obesity. That's getting rid of that huge risk factor and the development and death from these cancers. So some ways in which we can treat obesity include changing diet, exercising more, pharmacotherapy, changing lifestyle, modifying behavior, or in particularly bad cases, surgical treatment. In summary, obesity is associated with an increased risk of the development of many different cancers as well as death from those cancers. So physicians and patients should keep these risk factors in mind so that they can make the very best decisions for those patients' health. And the treatment of obesity through many different methods can help the situation by lowering a patient's BMI or their central obesity and thus decreasing their risk. Thank you so much for listening. I believe that's it.